Hi, Dr. Alan Martin here, one of the rheumatologists on staff at Tulsa Bone Joint. These kind of decisions kind of evolve over time. I can remember really early in grade school saying I want to be a doctor, and the reason why is my dad was a physician in small town Oklahoma, so I got to see it firsthand, but just very well respected in the community, so that's one of the early memories I have, and I wanted to emulate that. When I went through training, I trained at OU, and I realized that I wanted to see young kids and older people. So I did a combined internal medicine pediatric program, so was boarded in both of those specialties. And then when I was at OU, realized that they had one of the world leading staff and doctors in rheumatology, and it just made sense to stay there and do another 2-year fellowship to be trained for arthritis and those kind of conditions. Pretty much anything that hurts, we see. Of course, a lot of our cases are rheumatoid arthritis, which is probably 50 to 60% of our practice. But again, we see all kinds of autoimmune issues, which some are very, very rare, but then just basic things. We see a lot of regional things, tendinitis, bursitis, those type of things, and then some things like gout and fibromyalgia, and so really a wide variety of things. So we kind of see anything from regional things to very complex systemic processes. I think as a rheumatologist, you have to be persistent in the details. So I think any rheumatologist is very good at asking a lot of questions and getting details. We see people referred for just positive lab tests or just hurting in general, and it's our job to figure out exactly why they hurt. Since I'm a member of Tulsa Bone Joint, we have access to orthopedic doctors, to physiatrists, so we have plenty of camaraderie with other specialties. We think we're kind of a one-stop place for musculoskeletal problems, and obviously one of the evolving areas has been medications that we can actually infuse in their bodies or give them shots. So that's why we have a state-of-the-art infusion unit that we take a lot of care in delivering the medication safely. I love what I do because it changes people's lives. I think when I first started, especially in my rheumatology training, there was very limited treatments. Over the last 20-25 years, there's been amazing treatments that change people's lives. We can give medicine through their veins or shots, however we give it, but it can absolutely change people from, we know the progression of rheumatoid arthritis would be detrimental and is terrible. We actually change that, and I have patients that I can put in remission. I think that's why I love being a doctor.